I'm Dr. Joanne Watt. I'm a GP in Northamptonshire. I've been a GP in this county for the last 17 years. I really just wanted to tell you a little bit about this last couple of years, what it's been like, and how we're moving forwards together. I think it's first of all, it's fair to say that all of us have had a really extraordinary and in many times unpleasant last couple of years. Both staff and our population have been through really difficult times. People have done extraordinary things, and there have been some really sad losses, and people are still going through really, really difficult times. And actually, as GPs, we've been with our people all the way through. We have tried really hard to support our population. At the beginning of the pandemic, we were very much involved in making sure that the people who needed to be on a shielded patient list were shielded, that they had the support that they needed, and worked really closely with local authority colleagues as well to make sure that people got their food packages, and our social prescribers stayed in touch with people, and we worked closely with the pharmacies as well. And although it was a really difficult time, it was really helpful to be working with colleagues to support our population. And all the way through, we've been able to see patients who needed to be seen face to face and be able to do remote consultations where that was safe to do so. And that's something where we've had to adapt really rapidly. Some of us are well used to doing telephone consultations and have done that for many years. And personally, in our practice, we've done that for a long time. But for a lot of my GP colleagues, that was a very new experience. And for a lot of patients, that was a little bit weird as well. And people had to learn to work differently. We had to learn to work with hot and cold rooms. We had to work out how to work with PPE and masks and face coverings and make sure that everybody stayed safe. And also we needed to make sure that our waiting rooms were not full of people who were going to be transmitting COVID to each other. And so practices changed really, really quickly at the beginning of the pandemic. And this has been hard for us, hard for our patients, hard for our staff. And it's been 2 years of really constant change, making sure that we keep our staff and our patients as safe as we can possibly manage. And although we had reduced numbers of consultations for the first couple of months, since June 2020, it has been at least back to how it was from the point of view of number of appointments, and is getting busier and busier. And that is really, really challenging to deal with. We know that in our county, we've got 17,000 general practice consultations a day. We know that 60% of those are face-to-face or are home visits. And we know that that's at least 2,000 a day more than it was 2 years ago, alongside an amazing vaccination programme that my colleagues across the system have been involved with, and particularly within general practice as well. And all of that is something new and is something different. And we have done our best to step up to the challenges of what the last 2 years have thrown at us, and much of that we didn't know how to do, and we've learned really quickly. We've talked to each other, we've talked nationally and regionally, and it has been a really challenging time. And it's one of the reasons why the recent media attacks have been so upsetting for most of us. We know things are different. We know a lot of our patients are not getting the care that they could have previously expected or wanted, and we know that people are really frustrated, and we absolutely feel that. But it's been really hard dealing with the media attacking people as lazy. My colleagues are not lazy, but what we have is a situation where the demand for our services is far more than the capacity that we have. We don't have enough people to do to offer the services that we need across any part of the system, and this is not just general practice. All aspects of the public sector are finding it really, really hard to keep up with the needs of our patients. And I really just wanted to talk to you about some of the things that make this really difficult situation better, while acknowledging that both from a staff and a patient perspective, people are really frustrated. When you see an empty GP waiting room, you have a GP who is ploughing their way through multiple phone calls and administrative tasks. It is not that GP isn't doing anything. There is just not enough health professionals to provide the service that people need. There are days where it's not unusual for me to be in 150 or 170 sets of patient records, and alongside the 30 or 40 consultations I'm doing a day, there is a huge amount of making sure that people are safe, particularly where people's procedures have been delayed. And it is very hard work managing people's frustrations. And as I say, we'll talk about some of the things that really make a difference, but don't take away the difficulties of the situation that we're dealing with. I think the first thing that's really important is we talk about respect for colleagues across the whole system. So it makes a really big difference if we can all talk to each other in a civil way. We know all of the health and care professionals are stressed. We know everybody is working much harder than they've ever worked before, but it really helps to have respectful conversations with each other, and to make sure that we stay patient focused. Communication is really key. Making sure that we have good information in a timely fashion makes a really big difference to my ability to look after the patients that I care for. So we try really hard to make sure that communication is good. And people doing their own actions. So I think the temptation when you get busy is to pass jobs to other people. And often I have nowhere else to pass jobs to. So I think where people want a task done, if people are able to do that, it makes a really big difference to the patient we care for if they know that that task is completed. So whether that's a result or something like that, it makes a really big difference. And equally, I think making sure that we don't make promises on behalf of other people, that we may ask for somebody's opinion, but that we don't make promises for people, that makes a really big difference as well. We know that a lot of our patients are off sick. We know that sometimes the suggestion for sick notes comes from systems partners. And we know that if you're able to give somebody a sick note for their entire period of being unwell, that's actually really helpful as well. So particularly if people have had operations, not having to come to the GP 2 weeks in makes a really big difference, and that people signing them off and making sure that that person can have a proper convalescence is really helpful as well. And actually just talking to colleagues. So if you're worried about somebody, most GPs are happy to talk. They may not be able to get to the phone straight away, but actually most of us are really happy to talk as well. One of the things that actually has been really helpful in the pandemic is about the use of technology. And in particular, most of us are now using a system called Accurix that allows us to send texts and two-way communication to our patients. And that actually has been a really positive thing over the last few years, that we've been able to communicate with our patients directly. People could send photos, bits of information through, has made a really big difference to us. And we're now at the point where we wonder how on earth we worked without the technology. We've also got lots of templates, particularly we use something called Ardence templates, which can be shared across the system, which help us to gather information so that it can be retrieved later. And those things have been really, really helpful. But I think what I would also say is that actually the help that our teams have been able to offer each other has been incredibly helpful. And I've had a huge amount of help from my patients. Sometimes when the days are really hard, sometimes a patient just saying, I appreciate you. Or putting a comment on NHS Choices has made a massive difference to the well-being of my staff. If we have a comment on NHS Choices, we will share that. And I would urge you that if any of you have had really good experiences with your general practice during the last couple of years, if you are able to leave a comment on their NHS Choices, it really means a lot to them. They may be having a horrendous day. Most GPs are working 12-hour days most of the time. It is really hard to continue to be as compassionate for the last consultation as you were for the first consultation. And if your experience has been good, and we know that because of the survey that took place a year ago, that actually most people's experience is still good, please tell your practice. It will mean a lot to them. Equally with other interactions across, the more positivity you can give, the more that will be appreciated. And I think not to automatically blame general practice for the woes of the system. We're all in this together. The system is in a difficult place. We know that 3 or 4 of my consultations a day will always be people who are tangled in the system, whose procedures may be delayed, whose outpatients may be delayed. That is not the fault of the people who are doing the procedures or the outpatients, but just to understand that actually this is a shared frustration and it's not anybody's fault. We are all in this together, and we all need to support each other and to be kind and compassionate to each other as much as we can possibly manage. So I suppose my message to you would be, well done for everything you've done. Continue to communicate well, continue to be compassionate, and to take responsibility for what you're doing. And if in doubt, say thank you to the team, particularly your team in general practice, who will continue to be there for you, who do care about what happens, and will continue to look after you as we move forwards. Thank you. So I've talked to you a little bit about some of the changes, some of the things we've been through in the last couple of years, and some ideas of how we can work together across the system to support each other and provide the care that our population needs. And really just wanted, as a final point, just to talk a little bit about why I became a GP and how I see things moving forwards together. I became a GP because I care about my population. I joined my practice with very much an expectation that I would be looking after those people from the cradle to the grave, and that I would be their GP together with my team. And for me, the continuity and the ongoing relationship with my patients and with my staff is the reason I continue to do this. And even if I'm on my 150th set of notes of the day, that's why I continue to do it. And together with my team, it's really important that we want to continue to offer the care that you need, that we're not perceived as lazy, because all we want to do is to make the care of our patients better. We want systems to work as well as possible. And we want to be with you through the good and the bad times within your life, even if you are frustrated and even if things are as difficult as they are now. We do this because we care. Some of us care too much, but we really do care about the outcome for our patients and our families, and we will not discharge you from our services. So when you are with a GP practice, we will continue to look after you, and really just want to tell you about what it's been like, how we can move forwards together, and how we can have respect and compassion for each other as we move forwards. Thank you.